Podcast is now starting. All attendees are in listen-only mode.
Hey everyone, it's Dr. Dan Ritchie, president of the Functional Aging Institute, and thanks for joining us live on a Friday afternoon. Or if you're listening on the recording, thanks for joining us after the fact. Excited to have Andrea Leonard back. You were quite excited to hear her first talk a couple months ago, so we decided to bring her back, and we've actually decided to partner up and do some stuff together. So today she's going to be talking about her entire cancer and exercise training model and giving us an overview of the Cancer Exercise Training Institute. Andrea is actually a cancer survivor herself, and she might share a little bit of that story. So Andrea, thanks for doing this for us. Take it away.
Hey, thanks for having me, Dan, and thank you everybody for being here again, like you said, on this Friday afternoon. So yeah, I am a 34-year cancer survivor and was diagnosed with thyroid cancer just about this time 34 years ago, as I was graduating high school and ready to make my way to the beach for the summer. I was bombarded with a cancer diagnosis, and that kind of naturally changed the direction of my life. But as a result of struggling with my own weight and appearance and metabolism, in the absence of a thyroid, becoming a personal trainer seemed like a great way to not only help myself, but also to help others. And, you know, this was, I probably wasn't thinking that far ahead at the time, being only 18 years old. And to be honest, there was not too much going on as far as personal training back in 1984. You know, we were still wearing leg warmers and K-Swiss and leotards that, you know, shiny lycra and all that good stuff. So anyway, this all kind of came about after my mom's second diagnosis with breast cancer, and she asked me if I would help her in her recovery. And at the time, I was in Washington, D.C. I was actually training her breast cancer surgeon, and I said, hey, you know, what do you think about writing a book on exercises for breast cancer survivors? And she said, oh, that would be a great idea. So in 1995, we began what turned into a 3-year project, working with the chiefs of breast surgery at Georgetown, GW, and Johns Hopkins, along with a bunch of other amazing medical and fitness professionals, to write what was one of the first books on exercises for breast cancer survivors, and it's called Essential Exercises for Breast Cancer Survivors. It's out of print now, but it is still available on Amazon. And to this day, I got to tell you, it's one of the only, if not the only, progressive resistance program available, meaning, you know, we're going beyond just basic range of motion and stretching and actually helping people to get back to where they were, or in many cases, even better than before they were diagnosed with cancer. As you know, Dan, especially with the vast numbers of baby boomers, many of whom have cancer, a lot of them have never exercised before in their life. So we have the opportunity to create a healthier person than they've ever been before. And as you can see here, our medical advisory board consists of some amazing breast cancer surgeons, general practitioners, naturopathic doctors, PTs, OTs, lymph drainage therapists, and oncology nurses who contribute regularly to our material. And I'm so proud to have them as part of this project. So the bottom line is there's a huge market that we as fitness professionals can serve and help to grow survivorship. We have 1.7 million new cases just this year in the United States. And that doesn't account for the existing 14 million survivors. So with all of the progress that we're making, obviously with different forms of treatment, with early identification, we have many more people surviving the diagnosis of cancer. But on top of that, we have 100 million high-risk individuals. These numbers in particular are just in the US, that if we can kind of infiltrate the system and ally ourselves with the medical professionals to convey the importance of what we can do to help prevent cancer, we could have a huge impact. And despite the fact that there's all this research and so many studies showing that exercise can prevent cancer, it can help benefit during treatment, and of course help in recovery, there is still such a small percentage of people that are given any sound instruction. They might get, hey, you should exercise, and that's about as far as it goes. So really important, we've got 20.3 million survivors globally by the year 2030. And this is not great news. Obviously, it's going to affect us all. But in terms of a potential market for new clientele, I got to tell you, this is a huge untapped market. Now, the great news is that between 1990 and 2014, the overall cancer death rate in the United States fell by 25%. So, it's horrible that cancer is affecting so many of us, but on the bright side of things, at least people are living, they're surviving. So now we want to help improve their survivorship and their quality of life so that it's not just surviving. And I don't want to be cliche and use the word thrive, but it does work. So think about this, that somebody is diagnosed every few seconds with cancer in the United States. And I'm sure this applies anywhere in the world, but this just happens to be the statistic that I have. So despite the evidence, behavior remains the same. We know eating fresh, organic fruits and vegetables, a plant-based diet, exercise, all of these things that are good for us. And you still see people that are smoking and drinking, and I'm not talking about in moderation. They're not exercising, they're not getting enough sleep, and generally they're overworked, underrested, and they are prone to many diseases, not just cancer. We know that, and notice at the top of the list here is exercise, but exercise, eating healthy, quitting smoking, drinking in moderation. And there are some statistics that show, just for example, with breast cancer, that a woman who drinks, I think it's 2 to 3 drinks a week versus 1 on average, increases her risk of breast cancer threefold. So it begins to become exponential. And then ultimately losing weight, which can have a profound effect on many things. Diabetes, it can reduce the risk of lymphedema that can be associated with cancer, prevent heart disease, everything basically. So losing weight is a key factor, and many people who are going through cancer treatment unfortunately struggle with weight gain, particularly with hormonal therapy. So as far as exercise goes, it can reduce treatment symptoms. And I can't understand, knowing everything that I'm showing you here on this screen, why every single doctor does not break out the prescription pad and, so to speak, write a prescription for exercise, improve treatment tolerance, reduce nausea, increased appetite. And I talked about weight gain, but you have many people who have muscle wasting as a result of cancer treatment. So being able to have a hearty appetite and eat healthy foods makes a huge difference in their body mass. Reduced fatigue, maintain lean muscle mass. So obviously we want to increase lean muscle and lose body fat. Decrease pain, improve sleep. The body has to be able to sleep in order to recover both mentally and physically, because it's using all of its energy to fight the disease. 76% of cancer patients are affected by extreme fatigue. So exercise will help fatigue from all of the great endorphins that are produced, ultimately resulting in increased satisfaction with life and decreased depression. So I always tell people, our cancer exercise specialists, when we talk about building their business and working with the medical professionals, one of the questions comes up about creating a brochure. And this would be, in fact, these next couple slides are exactly what you want to put in your brochure when you're trying to, quote unquote, sell this concept, either to the medical professionals or to the cancer patients themselves. What are they going to get out of it? What benefits will they reap from this program? So this particular slide would go for during treatment. Now, in recovery, it can increase range of motion. So following surgery and radiation, oftentimes there is scar tissue and adhesions that limit range of motion. They also create muscle imbalances. And as you know, based on the kinetic chain, that if there is something out of whack or out of balance in the neck or the upper body, eventually it's going to affect every part of their body, you know, down to their feet, their ankles. A long-term risk with cancer, and when I say long-term risk, it can actually happen from the moment they have a lymph node removed or irradiated till, you know, 99 years later. They run this risk of lymphedema, and that is the swelling of the extremity or whatever part of the body that the lymph node was removed or the lymphatic system was damaged. And so exercise can help with the flow of lymphatic fluid, both preventing and managing lymphedema. And as a fitness professional, you are able to educate your clients about lymphedema. Many people, in fact, the masses, are not told, or they don't remember because there are too many other things going through their head. And lymphedema is entirely preventable with education and proper execution of exercise. So you have to understand the disease, and you have to understand how to slowly and gradually progress their exercise program, because doing too much too fast can actually bring on lymphedema. Additionally, we can increase lean muscle mass, lose weight in the form of body fat, a quicker return to work and activities of daily living, increase self-esteem and self-confidence, which is huge, particularly when you have people whose sexuality is affected, their fertility is affected. You know, they might have lost a body part, they've lost their hair, whatever, even if it's in the short term, giving them that little bit of self-confidence and that control over their body at a time that they feel they have no control. Cancer can strip you of everything. You know, your fitness, your energy, your self-confidence, sometimes your partner, your spouse, your job, your finances. So we get to give them that little bit of self-control back. Also increased energy, increased satisfaction with life, and prevent comorbidities. There can be damage to the heart and lungs from chemo and radiation. Long-term side effects of chemotherapy include osteoporosis and diabetes, and then also prevent future cancers. So here is, you know, that second page of your trifold brochure. And if this is not compelling evidence to exercise both during and after treatment, honestly, I don't know what is. You know, I'm not going to read you all of these statistics. I think we all have a pretty good idea of, you know, all of the disease. And while this is in the United States, this is a global issue, you know, with such a high percentage of both children and adults being physically inactive and obese. Many of them are morbidly obese. You know, when we look at their BMI, and they are at risk for so many of these different diseases on top of cancer. So somebody who's going through cancer, you know, this is something that's going to affect them for the rest of their lives. And the last thing we want them to have to contend with is another life-threatening disease. Last month was Exercise is Medicine Month, and there are a number of videos that we have on the YouTube channel if you want to take a peek. But we all know this. American College of Sports Medicine started this whole concept of exercise as medicine, and everybody claims to understand it, but we still have this drop off. So you've got imagine two mountains, and you know, the one mountain is the hospital, the medical side of things, and the other mountain is fitness and recovery. But then there's this huge cavern, if you will, in the middle. And we need to bridge that gap. We need to be able to get the patients from that one mountain to the other safely and effectively. And unfortunately, despite their best intentions, there are so many fitness professionals that, one, may be working with cancer patients and don't even know it because the person doesn't identify themselves as being a cancer patient or survivor, or two, they're doing the best they can, thinking that they are doing right by the client, that they're doing the right exercises, but in reality, they're not. And We have 500 pages worth of material that take you through the various surgeries and the treatments and the acute and chronic side effects to kind of teach you how to put all of these pieces together to get a safe and effective exercise program for your clients. And without knowing all of those little intricacies, potentially you can do some harm. So these statistics or bullet points are very well known, and if you type in, cancer research, you'll find this all over the internet. As far as how is physical activity linked with the reduction in the risks of cancer. And they're really for certain cancers. You'll see here breast and colon, and particularly hormonal based cancers. If we can regulate the hormones through exercise, then sometimes these cancers will not grow as quickly, because in the presence of estrogen or progesterone or testosterone, it's like fuel on a fire. Exercise can help prevent obesity, which of course there's so many negative side effects of obesity. Reduces inflammation, most importantly improves the immune system and its function, and it can it can speed up the passage of ingested food, so it is not in contact with the mucosal lining of the stomach for a long period of time. And so, of course, going back to a diet that is high in fiber, there's a good reason for that. Lifestyle equals outcome. So the bottom line is what we put in our mouths, what we put on our skin, what we breathe, how we exercise, right down to how we sit at our desk, and our ergonomics affect the outcome, the quality of our life. And 50% of doctors don't know how to prescribe specific exercises for cancer recovery. And they shouldn't. That's not what they're going to school for. Just like I am not prepared to go into an operating room and do a mastectomy or prostatectomy or give chemotherapy or radiation. We all have our area of expertise. So the medical professionals, doctors, PTs, OTs, nurses, you name it, need our assistance in supporting exercise programs for their patients. So that's where the cancer exercise specialist comes in. And this presents a huge opportunity for those of us who are looking to increase our client base to include cancer patients. So in this particular case, the need definitely equals opportunity. And if you take a look at these two pictures, you've got an example of a person who is not physically active, and let's just, for all intents and purposes, say that they choose not to be, because obviously there are some people that it is not a choice. But the difference between the person who is exercising in any form, any quantity, and any amount of times per week and duration, there is going to be a huge improvement in the outcome. And I just want to emphasize that. So let's break this down a little bit into the different components of exercise. So let's begin with flexibility. I'm going to give you a little visual here, and this applies to all cancers, but I think it's a little easier to understand when you think about breast cancer because we can visualize it. So after the removal of the breast through a mastectomy, there will be a horizontal scar on the chest, and sometimes two if they've had bilateral. Now, in the healing process, they can develop scar tissue and adhesions, which become very restrictive. They can also, I'm just dropping down a couple bullet points, limit the blood flow, hence the word ischemia, and that limited blood flow to the area can cause spasticity in the muscle that causes chronic pain. And this is what my mom has had to contend with for many years. So one of the most important things we need to do is increase range of motion and stretch the area. And based on the process of reciprocal inhibition, as we stretch the chest, simultaneously we're contracting the posterior muscles, which will help to maintain that muscle balance. Now let's add radiation on top of it. So now you've got damage from the radiation itself, which can cause even more scar tissue and restriction in that part of the body. So now this is affecting their ability to move their arm. if you just take your hand and you kind of clasp your armpit and your chest and try to move your arm through flexion, through abduction, through extension, external rotation, you'll see how limiting the movement is. The only thing that really won't be affected terribly will be internal rotation in this particular scenario, because they're going in the direction of the scar tissue and potentially the adhesions. So by improving and increasing range of motion, that's also going to help them to perform activities of daily living. When we think of things like reaching into a cupboard or scratching our own back, clasping a bra, washing your hair, all of these very fundamental things that we take for granted, when you can't do them anymore, it's very frustrating. And I know firsthand, mine from an injury, not necessarily from cancer surgery. If I have to scratch my back and I can't externally rotate my shoulder, I'm rubbing up against a tree like a dog. So working on range of motion is the first thing we need to do before adding strength training. And if we add any type of strength training before we regain range of motion, it only serves to limit their range of motion. So they will become strong in this limited plane of motion. So let me give you an example. Let's say your client has limited shoulder flexion, and we've gone through, we've taken measurements using a goniometer or eyeballing it. And you're like, okay, I'm going to give you a weight and I'm going to have you lying in supine position to do a pullover. And they are not able to go back to 180 degrees. Maybe they can only go back to 130, and they do 12 reps and they do 3 sets. And this is their regular routine. Well, what happens is they're going to be really strong from 0 to 130 degrees, but we're never going to increase from 130 to the potential 180. So we recommend that they have 90% of the lowest ends of the norms, which in this particular case are 135 to 180, no, 150 to 180. So 135 is the 90% before lifting weights. And I hope this makes sense, because I'm giving you a lot of information really quickly, that this is what the whole course is made up of. So I mentioned to you lymphedema, and that is when the lymphatic system is impaired and the area can pool with lymphatic fluid. It can be very painful, disfiguring, and also reduce range of motion. So the proper exercise, and when I say proper, I can't emphasize that enough. That includes how hot we allow the body to get, including a proper warm-up and lymph drainage exercises, and then starting and progressing very slowly, going when we're ready to do weight, we go from 1 pound to 2 pounds to 3 pounds, so on and so forth, without skipping large increments, because we don't know what their body can handle at this point. So doing too much too fast could actually bring on lymphedema. Already mentioned decreased pain. And then improve posture. And that kind of goes along with pain, because when the body is out of alignment and when we have the synergistic muscles doing the job of the prime movers, then they are often overused or overtaxed, and the strain can cause pain directly in the muscle, or it can lead to future joint degeneration. So not only do we have an opportunity to minimize pain right here, right now, but we also have an opportunity to prevent the degeneration that can cause pain in the future. And lastly, improved performance. So whether it's just getting in and out of bed, getting to and from work, activities of daily living, or if they're playing sport, we can help to improve performance. But you need to know, when is flexibility appropriate. So generally speaking, 6 weeks post-op with a medical clearance. You have to have a medical clearance no matter what. And there is such a thing as too much stretching, too much range of motion. If there is any pain, you are going too far. There should never be pain. So I always say to my clients, let me know the first onset of discomfort. So there should be a mild stretching sensation and discomfort, but no pain. And then limiting factors can include pain. So they're going through a range of motion and it hurts. Obviously, they're going to stop. Some people will be afraid. Maybe they have already gone through painful physical therapy, or they're afraid that their incision is going to open up. And I can tell you firsthand, when I had my incision, I still have it, of course, but when I had a fresh incision in my neck, I remember thinking that I would tilt my head back and my neck would just open up. So that is a very real fear to the person who is recovering from surgery. Now, if you guys have any questions, I don't know if you're fielding questions, Dan, but you're welcome to either submit them through this webinar and or email me, and I am happy to address them. The easiest email to remember is CETI, just like the acronym for Cancer Exercise Training Institute, CETI Guru, G-U-R-U, at gmail.com, and I'm happy to talk to you. All right, yoga and meditation as part of an exercise prescription. The benefits are relaxation, stress management, decrease in depression, reduces anxiety, also decrease pain. And when people have a lot of anxiety, they tend to tense up. Once again, we're going to go back to that ischemia, the lack of blood flow to the area, and the spasticity of the muscles causing pain. So the majority of pain is caused from that, particularly when we're dealing with surgical recovery. So if we can allow the muscles to relax, and even in yoga, you're thinking, holding a pose. I don't know how many of you do yoga, but if, let's say, you're in Warrior One, which involves you to hold your arms straight up, the goal would be 180 degrees vertical. Well, what happens if somebody can only bring their arms up 130 degrees? Just like strength training, if we don't improve their range of motion through a flow, even with yoga, movement, constant movement, then they will become stronger at that 130 degree point. And so I would have them, while they're doing Warrior One, continue to move their arms each time, trying to go up a little bit further, but making sure that the arms are staying in the plane of motion, because a lot of people will cheat and go out of flexion into abduction in order to get to gain more range of motion. So yoga will also help with improved performance and ultimately burn calories. Now, a low intensity yoga class may only burn 200 calories, but as somebody advances, and bear in mind, they're not always going to be in treatment. So 34 years later, I now do power yoga, and perhaps in 102 degrees and going from one pose to the next with my heart rate elevated, maybe I'm burning 600 calories an hour. So it's the hardest thing I've ever done, and I've been lifting weights for 3 decades. So even with yoga, you need to know when it's appropriate. Always get the medical clearance. There are things like peripheral neuropathy, where they have burning, tingling, and numbness in their hands or feet. So let's say they have it in their feet. There are going to be certain poses, many of which involve standing, that they cannot do with comfort. So perhaps you can modify it to using a chair. Things like inversions and balancing can be very difficult with neuropathy, both in the hands and the feet. And then if there's an area of the body, let's say somebody's had head and neck cancer or breast cancer, anything that would involve lymphedema in the upper extremity, holding a position, putting all of the body weight on the arms can increase the risk of lymphedema. So you're either going to want to find ways to modify it with blocks or pillows, whatever you have at your disposal, or create a different exercise, a different pose altogether to accommodate them. Too much of a stretch is not necessarily a good thing either. So I go back to, they should feel a mild stretching sensation, and it should not be painful. So if you're looking at your client or someone in your class that is cringing, or you see them really wobbling and struggling with their balance, proprioception is often affected during treatment, and people have a difficult time not only with balance, but just where they are in space altogether. And they may have some nausea at times or even dizziness. So keeping things safe is going to be the most important thing. And then being able to make modifications. Now, I keep talking about upper extremity, but let's take somebody who's at risk for lower extremity lymphedema, ovarian cancer, cervical cancer, prostate cancer, stomach cancer, you name it. So this means that if they do too much training with their lower body, that they could actually get swelling in their pelvic area and either leg and or foot. And so being on their feet for long periods of time, you know, standing up may be too much. So doing positions and doing poses in prone and supine position might be better for them, or also being in a chair, taking the weight bearing off the legs. And then lastly, to be able to incorporate lymphatic drainage exercises either at the beginning or the end of a class or an individual session will be incredibly helpful. It's a great warm up and cool down that I have used many times just as part of the course or part of the class. And people don't even know why they're doing it. So you can kind of sneak it in there. Swimming. Everybody asks me, what about swimming? Isn't swimming great for cancer patients? And of course it is, but that doesn't come without its risks. So as far as benefits, it can help increase range of motion, obviously depending on the stroke, but keep in mind with the repetitive arm movements and or leg movements that if somebody is at risk for upper extremity or lower extremity lymphedema, doing these repetitive movements can also bring on lymphedema if it's not monitored. So I'm kind of contradicting myself, because then the next bullet point I say it's great for arthritis in warm water, of course, and lymphedema. It's great for lymphedema in that the compression of the water around the affected area is really great for maintaining the elasticity and just the stability of the skin and the surrounding tissue. That doesn't mean that you can't still get lymphedema, but it certainly feels good, takes all the pressure off the joints, and it will keep somebody cool during a workout. Overheating is one of the risk factors for lymphedema. So that's another great benefit. Strengthens the heart. It can increase strength and also burn calories. The amount, of course, depends on the intensity of the swimming. But when is it appropriate? Can somebody get into a swimming pool 6 weeks after surgery? They have to be completely healed. They have to have the medical clearance. If they are immunocompromised, so their immune system is compromised, that means they are at risk for infection, a higher risk for infection. They should not be in the pool. So if they're going through chemo, if they're going through any treatment where their blood counts are low, now is not the time to be in a swimming pool. And that also applies to swimming in a lake, a river, or the ocean because of all of the bacteria that are potentially there. And skin irritation, if somebody is undergoing external beam radiation and they have radiation burns or even blisters, then that is also not recommended. And something for you to be aware of, if there is a blister and it opens up, that is the perfect medium for bacteria. The lymphatic system is going to respond by sending more lymphatic fluid to the area to protect it. And in the case of someone who's at risk for lymphedema, the risk will be elevated during that time. So all of these things are components of the exercise program, and you guys have to understand how to monitor and what to look for. Cardio as an exercise prescription will decrease fatigue, and I already mentioned that 76% of cancer patients will really be struggling with fatigue, unlike that we know on a day-to-day basis. So the cardio can help give them that increased energy. Bear in mind, if your client is leaving feeling more tired when they showed up, then you did too much. So they should always leave feeling no worse than when they came in, and hopefully more energized. That is a key benchmark for knowing if you're doing too much or you're doing the right amount. Naturally, it's going to strengthen the heart and lungs, and they may have been damaged by chemotherapy and radiation. It will burn calories and help to maintain that good body composition, which will, going back to one of the previous slides, help prevent heart disease, diabetes, all of the obesity-related diseases, but also help to minimize the risk of lymphedema, because the adipose tissue interferes with the flow of lymphatic fluid. So the more we can achieve a low body fat and a high lean muscle ratio, the risk of lymphedema will go down. And ultimately, this is going to improve their quality of life. So when is it appropriate? Again, they can start with basic walking as soon as the doctor gives them permission. But as far as you as a fitness professional goes, you have to have a medical clearance. So you might have a doctor give somebody a medical clearance 3 weeks after their surgery, but even if their incision looks like it's healed, there's still internal healing going on. So you're going to want to avoid things that are going to stretch out that area or contract or stretch. So concentric or eccentric contractions are both undesirable if the incision is not fully recovered. And I would say they need at least 6 weeks for that. And in some cases, it could be 8 to 10 weeks. So get your medical clearance. You have to look at whether they're in treatment and they're low functioning, they're in treatment, they're higher functioning, they are out of treatment, low functioning, or out of treatment, high functioning. All of these things are going to determine the intensity at which they work out. We use the Carvonin method to determine the heart rate that we want to achieve, because it takes into account resting heart rate, which can be affected with cancer treatment. So, somebody who's a low level is going to only be working at about 20 to 40% while they're going through treatment. And all of these are outlined in our materials, specifically, so you don't have to guess anything. Everything is provided for you. So if you are working them at too high a level, it can be very dangerous to that person. And that takes into consideration not only their age, their previous level of fitness, but like I said, what the actual treatment is doing to them. So something you want to definitely talk to their medical professionals about, or based on HIPAA, if you have to have your client talk to them, that may be the way to go. Think about the risk of falling. Many of your clients are going to be at a high risk of osteoporosis, not only just based on age, but the fact that chemotherapy is going to increase the risk of osteoporosis, as is taking corticosteroids. And if they have multiple myeloma or they have cancer that is in the bones, whether it be primary or secondary, we don't want to take a chance of them falling. So putting somebody on a treadmill may not be appropriate. Maybe they need to be on a recumbent bike or an elliptical, something that they can hold on to that's not going to move out from under them. Avoid things, like roller skating or bicycling outdoors or skiing or anything with a high risk of falling. And of course, working on balance exercise will help them, but until they're at that point where they're really stable, keep it very safe and consider whether or not they have peripheral neuropathy in their feet. If they do, they should avoid all high impact activities. And I would even include fast walking as high impact for the purposes of this discussion. So think of things that are not going to cause them any pain or any more pain, because peripheral neuropathy can be very painful. And think about the exercises that make sense. What is it you're trying to achieve here? Strength training. It's going to help with bone density, obviously. Reduced risk of osteoporosis. It is so important, especially when we are, let's use prostate and testicular cancer, for example. We are removing testosterone from the equation. They're going to lose lean muscle mass. They are also going to be at an increased risk of osteoporosis. So we're kind of doing two things. We're improving body composition and increasing bone density simultaneously. Burning calories. Lean muscle burns more calories than body fat. It's going to improve quality of life, increase self-confidence, increase strength, which will help them with their ability to perform activities of daily living. But you see two pictures here. One, you've got exercise bands, and I want to draw your attention to how she's holding that band. Notice she's holding it between her fingers. Let's just assume she's a breast cancer patient and she's at risk for lymphedema on that right arm. If she were to wrap that band around her hand or anywhere on that arm, she can actually increase her risk of lymphedema. So it is essential, and the same thing would apply to the lower body, that if someone's at risk for lymphedema, they are not restricting the flow of lymphatic fluid by any sort of compression, whether it be through a blood pressure cuff, a band, or even tight-fitting clothing and jewelry. You can do too much, and I talked about doing too much weight leading to lymphedema. So you've got to start and progress slowly. And once again, with peripheral neuropathy, if that woman has peripheral neuropathy in her hands and she lets go of the band, she can hurt herself or the trainer. Same thing with this guy. If he had peripheral neuropathy and drops that weight, he could end up getting hurt. So think all of these things through, as that's going to be the difference between success and failure. And even if it's success, what level of success? Balance and core are going to be critical, especially for our aging population. It's going to decrease the risk of falling, preventing injuries, particularly if they are already have osteopenia or osteoporosis. Many will have back pain as a result of muscle imbalances or recovery from surgery, so it can help reduce back pain and, of course, increasing strength, also helping to perform activities of daily living. And I want to emphasize safely, because people will use all kinds of terrible form to do what they have to do, but they're putting themselves at greater risk. So know which exercises are appropriate, as far as a stable versus an unstable surface, like a Bosu balance trainer, foam rollers, or any type of balance disc. Don't put your client who has peripheral neuropathy on balance discs. Start them on the floor. Progress to a Bosu balance trainer with walls on either side so that they don't lose their balance. Start with 2 feet, go to 1 foot. Learn how to progress and regress accordingly based on what your client needs. And just, you have to think this through based on kind of breaking it into upper body, lower body, and what they're at risk for. So why does mainstream exercise programming fail when it comes to cancer patients? This is kind of a profound question and something that maybe you haven't thought through. Well, it's not failing. We've got them exercising. Yeah, but it doesn't take into account whether or not your clients have acute or chronic side effects. Are you thinking about this list when you are prescribing exercises? Does your client have neuropathy? Are they at risk for, or do they have lymphedema? Are they at risk for, or do they have damage to the heart and lungs? Are they at risk for osteoporosis, diabetes? What are their blood counts looking like? Are they immunocompromised? Are you training them when you're sick? Are they laying on a dirty floor when their immune system's compromised? You might have never even given any thought to this. And quite frankly, if you've never been taught, it's understandable. Have they had any amputation? Did they have reconstruction with a muscle flap? Where did that muscle flap come from? And is that muscle still active? So for example, if somebody has a lat flap breast reconstruction, did you know that the lat will still contract and relax as it's fired, even though it is now part of the breast? Are you taking into consideration their fatigue level? The fact that they may have muscle wasting and have lost a large percentage of body weight. Hormone-related weight gain is very difficult to lose. You have to set realistic goals, and it can be very difficult to produce lean muscle mass, especially for the men who are going through hormonal therapy. So we certainly want to be encouraging, and we definitely want to do strength training, but know what your limitations are, and don't set unrealistic goals. And if they have vomiting or diarrhea, they should not train 24 to 36 hours after an episode. And lastly, and certainly this is not an inclusive list, but treatment days. They should not train within a few hours of treatment. And I often say, take a day or two and just schedule it. They're going to get into a pattern. They'll know what their good days are and what their not so good days are. Lastly, on this page here, every cancer patient has a unique experience. You cannot possibly take a group of cancer patients, even if they're all the same age, same gender, same level of fitness previously, and the same exact surgery and treatment. They will all respond differently. So do you know how to put together an exercise class with a variety of different cancer patients in that class? You must take a look at the age and previous fitness level, the complete assessment, and certain things you'll be able to do right away, like a postural assessment, which is critical, while you may not be able to do certain things, balance tests, squat tests, movement tests right away. They may not be ready for that, and that's okay. You need to know when they had surgery, the date or dates, where the incision or incisions are, as this will affect their posture. It will also affect their range of motion and what exercises you can do. Was there an amputation? Is the muscle still attached? And that would be the muscle flap. Did they undergo treatment? What are the date or dates? What are the acute and chronic side effects? Do they have a port? Because if it is exposed, that is going to restrict their ability to perform certain exercises, or for example, to be in a swimming pool. And then take into consideration all of the comorbidities that are associated with cancer surgery and treatment. Lastly, we've got safety and efficacy. What is the purpose for what you're doing? Look at the risks versus the reward. Obviously, the risks should be slim to none, and the rewards, anything that is progress, I consider rewarding. Be very specific with what your goals are, and ask yourself if it's relevant and appropriate for that individual at that time based on their current health history and future comorbidities. So that summarizes a whole lot of information that is available in our Cancer Exercise Specialist and Breast Cancer Recovery BOSU Specialist course. Want to let you know that we are doing a special with FAI this month so that you can help us help the 114 million people that can benefit from your services who are either at risk for cancer, high risk, or already have undergone cancer treatment and are also in recovery. So this is going to be available on our website here. And the amazing thing, in addition to these two wonderful certifications and advanced qualifications through FAI and CETI, you're going to get a MedFit Network membership to help build your business. You will have a directory listing both on their site as well as CETI. And we are working to drive clients to you as well as let them know that you are there. So great savings. This is a $1,069 value, and I believe you're getting it for $599. That is US dollars. You can register right here on the website. And I thank you all for joining us today. Thank you, Dan, for hosting. And we will have Dan Ritchie, I think same bat time next week, doing his webinar to educate everybody on the Functional Aging Institute certification.
Awesome, Andrea. Thanks so much. Do you have 10 minutes to stick around for some Q&A?
Yeah, absolutely.
All right. So we've got, looks like about 40 people on live with us. If you've got questions, go ahead and type those into the question box now. For those of you on the recording, obviously you're going to have to reach out to Andrea directly to ask any follow-up questions on today's presentation. And what a deal here we've put together, 2 certifications plus the MedFit Network membership, all for $599. So that's really cool. So people can go to the cancerspecialist.com/shop. That's where they can find the combo deal.
Well, and wouldn't you say, Dan, that, you know, even with these amazing certifications and courses, if people don't know how to utilize it, if they don't know how to market themselves, then it doesn't do you any good. So I know you do this, and we're going to be having ongoing webinars on building your business as a cancer exercise specialist and helping these guys create this revenue stream. So beyond just saying, hey, I've got this certification and yay, I've got my CEUs, let's turn this into an effective business plan.
Oh yeah, absolutely. I mean, I say all the time, it doesn't do you any good to have 9 certifications and 2 clients, you know. So let's have two
Exactly.
certifications and 90 clients. So yeah, for sure, you've got to be able to build your business. So Kate, absolutely, we recorded the whole webinar. Kate asked, will we be able to access this later? I came in late, and she also was interrupted by a neighbor. So yeah, Kate, you should be sent an automated email in about an hour or two with the recording, so you can review all this material again. Seth, confused about the special. For those of us who are already FAI certified, why are we paying for both the cancer exercise specialist and the FAI? What is our cost for just the cancer exercise? Great question, Seth. We do have a discount for you to just do the cancer exercise specialist.
Yeah, I think
I believe
it's
you have a
$349.
you have a code for that. A code for
Yeah.
that, right, Andrea? I think it's a combo code.
Yeah, and it's also, if they go to that same web page, they will see the option. So beneath the dual package, they'll see the option, because we're going to have cancer exercise specialists who just do the FAI and vice versa. So great question.
Yep. Absolutely, Seth. We don't expect you to buy both courses when you already have one of them. So we have them individually discounted for people. So Paulo, great talk and webinar. I was invited to give a talk workout tomorrow for 30 women with MBC. I don't know these women. What advice do you have?
I'm not familiar. What does MBC? I'm thinking something metastatic breast cancer is what I'm guessing that is. So if he can let us know. And what is the question again?
Yeah, metastatic breast cancer. He's giving a talk to 30 women tomorrow with metastatic breast cancer. He doesn't know the women, so obviously he isn't going to know all what's going on. What advice do you have? I think for
oh boy,
well,
my first question, and Paulo, good for you. My first question is why are you giving this lecture? So, do you have experience working with breast cancer? Would be my first question, because, and I'm not trying to be belligerent. But there's a lot of information you should know, and I'll gladly speak to you privately if you'd like about things that you need to bring up. But bear in mind, metastatic breast cancer is stage 4. It means that it has spread to other organs or into their bones. The prognosis is usually not as good. So I would certainly say you want to focus on positivity, definitely not get into anything negative, because these people are probably struggling tremendously with their own, their own will and, wanting to fight. But I can't even begin to answer that question, because we've got to take into account lymphedema. We got to take into account what surgery they had, when they had it, if they had reconstruction. Is your talk on exercise, or is it a motivational talk? So Paulo, if you want to email me, I'm happy to talk to you, and I'd be also happy to make the answers available to everybody else. But that is a hornet's nest.
Yeah. Okay. Well, I'll introduce you to afterwards. Paulo does. I know Paulo has run a training studio in South Florida for over 10 years now, and he says he has a great relationship with the Susan G. Komen group there in his area. So I'm guessing they've asked him to give a talk. And
yeah. No, that's fantastic. And he may know everything that needs to be talked about. So either I can steer him in the right direction, or maybe bring up some things that he had not thought of.
Awesome. Excellent. Thanks, Andrea. All right. Other questions for Andrea before we wrap up and let her go? And again, if you're on the recording, what's the best way for them to ask you follow-up questions, Andrea? How do you want them to reach you with questions?
Probably the easiest is just email me at CETI, like the acronym for Cancer Exercise Training Institute, Guru, GURU, at Gmail. They can also call 503-502-6776. That's on the West Coast. While you're seeing if anyone else writes a question, I have something to ask you that I think might be valuable for our audience. One of the things that comes up often is liability. And In the various personal training certs that I have, it talks about working with special populations. And, I have the ACE certified personal trainer book that I've been reading because I have to retest. And they even say, they cover little bits of each disease, but they're like, you need to get specific training for each special population. So whether it's, FAI or CETI, anybody who's working with a special population, I can't emphasize enough the need for specific education and certification in that area, not only to do the right thing for the client, but to protect them as an individual from legal action, legal recourse for working with a population that you are not trained to work with. What is your opinion on that, Dan?
Yeah, I mean, I think there tends to be in the fitness industry, there's a lot of loosey-goosey stuff that goes on, and if you are working with someone with a serious medical condition like lymphedema or significant cancer prognosis, and you have no clue what you're doing and no business working with them, then you're increasing your liability, since you're kind of stepping out of your bounds of what you know how to do.
Right.
I think you're probably in less trouble if you're the average certified personal trainer working with a 62-year-old. But that's where we see lots of issues too, right? And you're like, oh, I just thought I'd train them like they were 25, and then you hurt them,
Exactly.
and then you set yourself up. The reality is, at any time we could be sued by a potential client.
Sure.
The reality is, the likelihood of us losing that lawsuit and having our business adversely affected goes up disproportionately if we're working with someone we have no business working with, right?
Right, and the key word is gross negligence. So if they can prove gross negligence, and I just think that's important to bring to the attention, because I know the people who are going to be listening to either of us are probably more advanced trainers working with special populations. So I just want to make sure that they know they need to, dot their I's and cross their T's.
Yep, absolutely. Couldn't agree more. I think overall, we need to try to continue to keep improving the profession, right? And having people working with people they're qualified to work with, they have expertise to work with, and reaching out for help when they run into a case that they're not sure, so.
Absolutely. And we're not all good at everything. I only do cancer because it takes up way too much brain power to do anything else.
Right.
Were there any other questions, or are we?
I think that's it. I think Paulo, I introduced you to Paulo via email. He wants to hop on the phone with you since he's got obviously 30 women he's talking to tomorrow. For those of you listening on the replay, reach out to Andrea directly, and I hope a bunch of you take advantage of this bundled deal we've got going. And Andrea, I will see you on Tuesday where you're hosting me, so that'll be fun.
Looking forward to it. Okay, well, thank you, Dan, and we will talk soon, and thank you everybody for being here.
All right, bye-bye.
Bye.